Hello, my name is David Kuhl. I'm the director of the Center for Practitioner Renewal, which is a center that provides psychological support to healthcare providers at Providence Healthcare. So that means anybody that works there, doctors, nurses, OTs, PTs, administrative staff, frontline staff, anybody can come to us for some help in terms of their ability to function well at work. I also have been, for the last 15 years, I've been involved in working with men in the military, with RCMP officers and with corrections officers. So I've also been focusing on areas of work that result in depression, anxiety, grief, shame, anger, lots of other features that affect how men function in the world and how they relate to the people who are close to them. Whether it's the healthcare providers or the military people, one of the most difficult features of dealing with depression is asking for help or acknowledging that something has changed, something's different on the inside. And what's interesting is that the military and healthcare are both steeped in the philosophy of Stoicism. So if there's an emotion that can impede your ability to function well at work, get rid of the emotion. So that men that I've worked with in those domains are often in denial, or they suppress it, they depress their emotion of anger, of shame, of fear, resentment, things that aren't going as well as expected. So the biggest issue, or one of the primary issues, is can they walk down the hall through the door and say, I could do with some help, or can we talk? I think that primarily our work with men's groups and very focused work with men's group has to do with the men in the military, RCMP, corrections. And that is that a group of men come together who are accustomed to being together and are often isolated and alone in their sense of being different or feeling the depression. So that bringing these men together because of common ideals, because of common work history, common experience, creates an environment in which they feel safe enough to begin to edge toward the other issues and concerns they might have with regard to things that affect their ability to function well in life. In my experience, men are most eager, most able. I don't know that I've ever met men who are eager. Men who are most able to ask for help is when they've lived with something for a long period of time, when they find that their experience of life is intolerable, or when somebody else says it's time for you to ask for help. And that's quite common. Whether it's a partner, male or female, a girlfriend, a close friend, it's usually somebody that's close to them and cares about them that is also at their wit's end, not quite certain what to do next. But the cost of the depression is too great on the individual and the relationship, so that the partner can no longer be quiet.